Let's talk about the laboratory test for clotting factors. We have just mentioned to say if you hate yourself, blood is going to be coming out, and so you need to control that. The body has got a mechanism that it uses to control the loss of blood like that because it can result into anemia. So that process is called blood clotting or coagulation. We have said it is mediated by platelets and proteins. Those proteins we call them clotting factors, and we have got the 12 of them starting from number 1 to number 13. We say 12 because we don't have 6. We can simply know them by saying foolish people try climbing long slopes after Christmas. Some people have fallen. Fibrinogen, prothrombin, tissue factor, calcium ion, labor factor, stable factor, and hemophilic factor, Christmas factor, Stuart factor, plasma thromboplastin, antecedent, and man factor, fibrin stabilizing factor. So we talked about these two pathways. We have got the intrinsic and then the extrinsic, and those are connected by the common pathway. So then how does that happen? For the intrinsic pathway, you are going to have the collagen or other substances just in the blood vessels. They are going to be exposed, and when they're exposed, they're going to activate uh, factor number 12 to 12A. 12A is going to now activate 11 to 11A in the presence of calcium. 11 is going to activate 9 into 9A. And then the 9 is going to activate 8 into 8A. That 8 now is going to convert 10 into 10A. The A just means activated. All right. So the extrinsic pathway, we said you are going to expose the tissue. The tissue has been hit, so tissue factor is going to be released, which is factor 3. It converts factor 7 into factor 7A. The 7A now converts 10 into 10A. So intrinsic and extrinsic. So the formation of 10, factor 10A, that is going to be stage 1. That is now going to be what we call prothrombin activator. So this prothrombin activator, what does it involve? It has got a lot of things. The 10A, that is factor 10A, which has been activated together with lipoproteins, factor 5, and then factor 4, which is just simply calcium. They are going to be together forming what is known as the prothrombin complex. That prothrombin complex is going to convert prothrombin into thrombin. That is stage 2, conversion of prothrombin to thrombin. And so on these stages, you can have the anticoagulation pathways. Now, we forget about anticoagulation. When we convert prothrombin to thrombin, then that thrombin which has been formed can convert now fibrinogen to fibrin. Okay, fibrinogen into fibrin. Now, this fibrin which has been formed is what forms a mesh on the wound, but it is not that strong. So we now need fibrin stabilizing factor. Fibrin stabilizing factor is factor number 13. That is the one now which is very much strong to form a mesh. So for fibrin stabilizing factor, it has also to be activated to the activated form by the same thrombin which converts fibrinogen to fibrin. So this is also the pathway that we've talked about. Now let's talk about the laboratory tests for clotting factors. We have got two laboratory tests. We have got first the PT, which we call the prothrombin time, and we have got APTT, which is activated partial thromboplastin time. These are the common laboratory tests which we use to evaluate and assess whether these clotting pathways are they are strong enough. So we use to assess integrity of the clotting pathways. So if you find that the time is not normal, then you are going to know there should be bleeding or there should be a clotting disorder or there should be something wrong, and so you are going to do something. All right, starting with the prothrombin time, which we call PT. So the prothrombin time is simply used to measure the clotting time in the extrinsic pathway. Now, because the extrinsic pathway simply comes from tissue factor number 3 activating 7 to 7A and then 10, it is very short because it has only like two factors involved. So you are going to use it to assess, okay, whether the factor, first starting factor 3 Let's start with factor 2, which is the prothrombin. We also have factor 1. So let me start with this. When you are talking about the PT, the prothrombin time, you are talking about the extrinsic pathway. Now you are going to merge it together with the what? With the common pathway, because it's the common pathway which gives us that mesh on the wound to stop clotting. Okay, so we're going to measure the time. Now, what is involved in the common pathway? I've got the fibrin, the prothrombin, and then you have got factor 10, okay, and factor 5. These are the ones now which form that complex which converts prothrombin to thrombin. You also have factor 7, right? We also, of course, have factor 3. So these are the ones which are going to be trying to see if they are working well in the PT or the prothrombin time. So the normal time it takes in the extrinsic pathway is about 11 to 13.5. So if you see that the clotting is so very much fast in the extrinsic pathway, for example, it is less than 11 seconds, then that would mean there should be something wrong. There is hypercoagulable state, meaning that you are clotting too much fast. Right? That can mean that there is factor 5 mutation, or there can be prothrombin gene mutation, or there can be the presence of anticoagulant inhibitors. So these inhibitors, so anticoagulants, they prevent coagulation. Now, inhibitors of those which prevent coagulation, these ones promote coagulation, meaning there's too much coagulation happening. And then if it is too slow, meaning, for example, the clotting takes more than 14 seconds, right? So that might mean that there is a deficiency of vitamin K, because vitamin K is important in this clotting factor, or there is malabsorption of vitamin K. Another thing, it might mean that there is warfarin therapy. That means there is anticoagulation medication. Now, we are going to talk about the warfarin therapy, what this does. How does it increase the time of coagulation? It also might mean that there are some certain inherited clotting factor deficiencies. For example, there is a deficiency in factor 7. If there is a deficiency in factor 7, it means that there will be no conversion of factor 10 into 10A. So this is the PT. Take note of the normal time from 11 to about 13.5 seconds. And then we have got the activated partial thromboplastin time, APTT. So for this one, it is there to measure the time in the intrinsic pathway. So if you measure the time, you are going to know if those factors which are involved in the intrinsic pathway, they are working okay. Now, in the intrinsic pathway, we also include the common pathway, just like the extrinsic, we're also including the common pathway. So factor 1, factor 2, factor 5, we know 8 is in the intrinsic, 9 is in the intrinsic, 10 is in the common, 11 intrinsic, and then 12 intrinsic. So these are the ones we're trying to see if they're working okay. So the normal range for APTT is about 25 to 35 seconds. So if it is too much or too low, that might show a problem. So what does it mean if it is too fast, meaning that the time is low? Okay, for example, clotting just happens within a very short period of time. That might mean that there is elevated clotting factor. The clotting factor is too much, or there can be presence of thrombotic conditions such as antiphospholipid syndrome. These are making the clotting to happen so much quickly. Now, if the clotting is too slow or there is prolonged time, for example, after 35 seconds, that is when blood is clotting, you are going to lose a lot of blood. So this can be due to deficiencies or dysfunction as hemophilia in factor 8 or factor 9. So factor 8, we said the deficiency causes hemophilia A, 9 hemophilia B, 11 hemophilia C. Okay, they can be also maybe von Willebrand disease, lupus, anticoagulant presence, and also heparins. So if we can be able to see all this time, these are the possible conditions that we are able to link these two. So this is it for this tutorial. In the next tutorial, we're going to talk about the anticoagulation pathway.